cases go down, there's going to be so many people suffer. As I said on my last report, already, the suicide rates are higher than the deaths by COVID or deaths with COVID. And it's important to see this in the narrative when the media talks about it, how people with COVID-19 die. They're not saying they're dying of COVID-19. They're not saying they're dying of coronavirus. They're dying with coronavirus. It's the same as someone dying with a broken leg or dying with a headache or dying with a T-shirt on. It doesn't mean they died from having the T-shirt on. If someone died with COVID-19, it doesn't mean they died of COVID-19. And they've told you in their own reports that that's how they're categorising. And there's even that one idiot, that woman from the United States, who was saying that she's disappointed that some people are not categorising some deaths as COVID deaths when they should be. They're saying, if someone comes in and they got stage 5 cancer and they die of stage 5 cancer, but they happen to have COVID, then it should be put down as a COVID death.
There are other countries that if you had a pre-existing condition, and let's say the virus caused you to go to the ICU and then have a heart or kidney problem, some countries are recording that as a heart issue or a kidney issue and not a COVID-19 death. Right now, we're still recording it, and the great thing about having forms that come in and a form that has the ability to mark it as COVID-19 infection, the intent is right now that if someone dies with COVID-19, we are counting that.
If someone dies with COVID-19, we are counting that.
Anyone who has COVID when they pass away will be included in that category. Dr. Ngozi Ezike explained this does not mean the virus caused that death, but if someone does test positive for COVID before dying, that is classified a coronavirus fatality.
You were in hospice and had already been given, a few weeks to live, and then you also were found to have COVID, that would be counted as a COVID death. It means that even if you died of a clear alternate cause, but you had COVID at the same time, it's still listed as a COVID death. So everyone who's listed as a COVID death doesn't mean that was the cause of the death, but they had COVID at the time of death.
How does this work? They died of stage 5 cancer. Just because they had that, like I said, it's like, if someone goes in there and they've got stage 5 cancer and they're on death's bed, but they happen to break their leg on the way into the hospital, are you going to put down they died of a broken leg because they happen to die with a broken leg? It's the same thing. They go in there with stage 5 cancer, they're about to die, but they test positive for COVID-19 with these tests that will test a poor positive. And then they say, they died with COVID, so it must be a COVID death. That's how come you can have reports coming out in England where they're saying, another 630 people died this week with COVID. It's a scam, folks. They didn't die of COVID, they died with COVID. Here it is, folks. Coronavirus. I'm dying. I need to call the medics. The crows agree with me anyway.
Can you repeat what you just said, please?
Well, last Friday, I received a 7-page document that sort of told me that if I had an 86-year-old patient that had pneumonia but was never tested for COVID-19, but sometime after she came down with pneumonia, we learned that she had been exposed to her son, who had no symptoms, but later on was identified with COVID-19, that it would be appropriate to diagnose on the death certificate COVID-19. Now, we've not done that. If someone has the pneumonia and it's in the middle of a flu epidemic, and I don't have a test on influenza, I don't diagnose influenza on the death certificate. I will say this elderly patient died of pneumonia.
I don't mean to interrupt you, but my heart is sinking right now as you're telling me this. You're a doctor. Why in the world would they be sending you out information to fill out death certificates, whether the person's been diagnosed with COVID-19 or not, but then to say in the death certificate this person's death was caused by COVID-19? That does not sound right to me.
I went to the person in our office who does most of the death certificates over the last 10, 20 years, and I said, does this sound right? I had her look at the documents that I printed off, and she said, well, we've always been told that you always put down just facts. You don't put down any probabilities. You don't put any presumptions down. It's just what you know. And so this is concerning, and it actually gets to your point, Chris. When we start talking about the data that goes into the modeling, we have to ask ourselves a question. Are we being forthright? Are we sharing with the public? Minnesota, North Dakota, we don't need to be having it sugar-coated. We want to know what's going into your modeling.
So with that being said, why would they want to skew the number of deaths due to COVID-19?
Well, fear is a great way to control people.
Just a couple of weeks ago, quote, the flu has a mortality rate of 0.1%, 0.1%. This, meaning the coronavirus, has a mortality rate of 10 times that, close quote. Here's Dr. Jay Bhattacharya in his piece in the Wall Street Journal. Again, this is March 24th, just a couple of days ago. Quote, and you're talking about when you think the virus was first seeded in this country. Quote, an epidemic seed on January 1st implies that by March 9th, about 6 million people in the U.S. would have been infected. As of March 23rd, it's that Monday of this week, there were 499 COVID-19 deaths in the U.S. That's a mortality rate of 0.01%. In other words, a whole order of magnitude less than Dr. Fauci claimed just a couple of weeks earlier.
I mean, I think the thing is, nobody knows the number. He knows the number. He knows the number.
Italy's Minister of Health. This is what he said. He said, the way in which we code deaths in our country is very generous in the sense that all people who die in hospitals with the coronavirus are deemed to be dying of the coronavirus. On reevaluation by the National Institute of Health, only 12% of death certificates have shown a direct causality from coronavirus, while 88% of patients who have died have at least one premorbidity. Many had 2 or 3. My next guest is a doctor and state senator in Minnesota who is deeply troubled by the CDC's latest guidance for counting COVID deaths. Dr. Scott Jensen joins me now. Doctor, I want to read for our viewers what the CDC says in part about how to count COVID deaths relating to that last issue we just raised. In cases where a definite diagnosis of COVID cannot be made, but is suspected or likely, like the circumstances are compelling with a reasonable degree of certainty, it is acceptable to report COVID-19 on a death certificate as probable or presumed. So, doctor, what's the problem with that?
Well, in short, it's ridiculous. I spent some time earlier today just going through the CDC's manual on how to complete death certificates and the parts that were specifically written for physicians. And in that manual, it talks of precision and specificity, and that's what we were trained with. The determination of the cause of death is a big deal. It has impact on estate planning. It has impact on future generations. And the idea that we're going to allow people to massage and sort of game the numbers is a real issue, because we're going to undermine the trust. And right now, as we see politicians doing things that aren't necessarily motivated on fact and science, the public's their trust in politicians is already wearing thin.
And doctor, in that same CDC guidance sheet on COVID-19, it references the fact that basically this is a judgment call for doctors on how to fit, I read it, what goes on line 1 and then what goes on line 2 and what goes on the final line as far as contributing factors and ultimate cause of death. But they concede that it is a judgment call. Again, why is that not correct?
Well, let's just take influenza. If I have a patient died a month ago, had fever, cough, and died after 3 days, and maybe had been an elderly, fragile individual, and there happened to be an influenza epidemic around our community, I wouldn't put influenza on the death certificate. I've never been encouraged to do so. I would put probably respiratory arrest would be the top line, and the underlying cause of disease would be pneumonia, and on the contributing factors, I might well put emphysema or congestive heart failure. But I would never put influenza down as the underlying cause of death, and yet that's what we're being asked to do here.
Dr. Fauci was asked about the COVID death count today. Here's what he said in part.
What do you say to those folks who are making the claim without really any evidence that these deaths are being padded, that the number of COVID-19 deaths are being padded?
You will always have conspiracy theories when you have very challenging public health crises. They are nothing but distractions.
Conspiracy theories, doctor? So you're engaging in conspiracy theories. What do you say to Dr. Fauci tonight?
Well, I would remind him that anytime healthcare intersects with dollars, it gets awkward. Right now, Medicare has determined that if you have a COVID-19 admission to the hospital, you'll get paid $13,000. If that COVID-19 patient goes on a ventilator, you get $39,000, 3 times as much. Nobody can tell me after 35 years in the world of medicine that sometimes those kinds of things impact on what we do. Some physicians really have a bent towards public health, and they will put down influenza or whatever because that's their preference. I try to stay very specific, very precise. If I know I've got pneumonia, that's what's going on, the death certificate. I'm not going to add stuff just because it's convenient. I think that it's not a conspiracy theory at all.
Yeah. So you reject what he said?
Absolutely.
Well, it's interesting that in Italy, where it's socialized medicine, I guess they don't have an interest in the money, if that's what it is here, and they just went back and they started reclassifying deaths according to their top scientific advisor. So they admitted that they were being liberal or generous in how they coded some of these deaths, and they're just going back and reclassifying them. Does that surprise you?
It really does. I mean, let's just take someone getting hit by a bus and they collapse along and they go into the emergency room and they're there for 15, 20 minutes and blood work comes back, COVID test comes back positive, and they die 20 minutes later because of their collapsed lung. We're going to put that down as COVID-19? That doesn't make any sense. 20 minutes later because of their collapsed lung. We're going to put that down as COVID-19? That doesn't make any sense.
There's a lot of people now speaking out, and actually these are including medical experts and scientists who are actually speaking out about the coronavirus case numbers. And they're wondering that if the coronavirus case numbers, that it may not be as accurate as we may have hear throughout the media, mainstream news. So then the statistics are questionable.
He knows the number.
What if the experts are wrong? What if quarantining the healthy doesn't actually save lives? What if wearing a mask in public is not effective? My name is Dr. Jeff Barkey, and I'm here representing thousands of physicians across the country whose voices are being silenced because we don't agree with the mainstream media and the experts who are telling us what to do. Never in the churchgoers that it's illegal for you to exercise your First Amendment right of freedom of religion. Yet at the same time, it's essential to keep pot dispensaries open. Never in the history of this country have we been told that you can't go to church because it's non-essential, but you can go get an abortion because that's essential. Never before in our country have we let criminals out of jail, but we've told you you can't exercise your Second Amendment right and protect yourself by purchasing a firearm. When liquor stores are deemed essential, but your businesses are deemed non-essential, there's something wrong going on. This booklet, the Declaration of Independence in our U.S. Constitution, was never designed to restrain the people. It was designed to restrain the government. This is not New York, and thank God this is not San Francisco. Governor Newsom has gone too far. Governor Newsom has stepped on our liberties and our freedoms. As a physician, I can tell you, yes, this virus is dangerous, but as we see the statistics come in, we're realizing that the fatality rate of this virus is in the ballpark of a bad seasonal influenza. What we're also knowing is that just like other respiratory viral illnesses in the past, we get over this virus by achieving herd immunity. We can never achieve herd immunity by keeping the herd quarantined. It's time that we protect the vulnerable and the most at risk, but we allow the young and the healthy to open the doors and go back to work. Do not let your voices be silenced. Make sure that your elected representatives, who apparently are essential, hear your voice loud and clear. As we see unemployment rise to depressing levels, we also see suicide increase. We see domestic violence increase. We see child abuse increase. We see alcohol and drug abuse increase, all because the government has overstepped its reach. We will see eventually that this government-imposed cure is going to be worse than the virus itself. But what's happening now as unemployment reaches 20 to 30 million people is those folks are now becoming dependent on the government. And what government dependency causes is a larger, more tyrannical government. We the people want to get back to work. We the people want to put our government back in its place. We want a small representative government, not a large tyrannical government. I'm here representing thousands of physicians around the country whose voices must be heard. It is an honor and privilege to be here to ask that Riverside County be opened. We want Orange County to be opened. We want the whole state of California to be open. People will not take it any longer.
common sense, folks.